7:54. Welcome back to Breakfast Television. Well, do not lose the battle with seasonal allergies. It can be a tough one to fight, and we have tips on fighting them from pharmacist Agusia McGrath, who's from London Drugs this morning. Good morning to you.
Good morning.
Well, it has been an extended winter, so we are seeing symptoms in seasonal allergies right now, and this will peak. When does it peak? When's the season?
So usually it peaks around spring, and then it once again peaks around fall. But because the weather is at the moment, we're wanting to make patients aware of what they can start doing to help them manage their seasonal allergies. I usually recommend, it's like there's a lot of confusion out in the place in terms of, do I have a cold? Do I have allergies?
Yeah.
And so I usually like to differentiate between the two. If you're getting the same symptoms year after year at the same time, you've got the runny nose, the itchy eyes, some itchiness in your throat, those are more typical of allergic symptoms.
Right.
If you've got fever, aches and pains, itchy eyes, runny nose, that's more associated with a cold.
Okay, so sometimes the symptoms can cross over, and you want to make sure you're treating the right thing.
Exactly, because otherwise you're not going to get the relief that you're really looking for.
And people who do have allergies truly do suffer, and there's sort of a comprehensive way to manage them. So what do you recommend?
So I think that the most important thing is really to speak to your pharmacist so that they can understand, number one, do you have any medical conditions? Number two, are you on any other types of medications? Because there's certain treatments that you don't want to take. For example, decongestants, they may increase blood pressure. So that's why we usually recommend that patients speak to their pharmacist. Then there's a whole range of different medications depending on the symptoms. If you've got more ocular symptoms, so those really red, itchy eyes, then you're going to go more for the eye drops. If you've got nasal symptoms, runny nose, itchy throat, sometimes a nasal spray is a really good option. And if you're wanting to have more of a daily medication, then oral treatments are excellent option as well.
Great, and I'm sitting in front of humidifiers here,
yes.
so do these actually make a difference?
So it's one of my tips that if patients are severe allergy sufferers, it's a really good idea to look at things that you can do holistically to manage the condition. And so air purifiers are a great way of removing the triggers that are in the air, so those allergens that are actually causing those symptoms that you're experiencing. Mm-hmm. And that is one of the symptoms, well, one of the additives that I usually recommend for patients.
Okay, excellent. And one of your other tips is to actually know your triggers, and how do you help people identify those?
So the triggers are either your dust, your pollens, your animal danders, and that's where it's about having a discussion with a patient. Do they notice when their symptoms are worse? Are they aware of what's causing their symptoms? And that's how you help patients identify triggers. The other thing is there are allergy testing that patients can go through with their healthcare professional. Mm-hmm. So if you're not sure and the symptoms are really severe, then that's another way of differentiating and identifying those triggers.
Right, and consulting a pharmacist is a great way to really get some information, and you can surpass your doctor in some cases.
So it's a good start because you can manage the allergic symptoms. If you're not getting any relief after you've been recommended certain medications after 2 to 3 weeks, then it's a good idea to speak to your healthcare professional because there are other prescription medications that patients can use.
Mm-hmm. Okay, terrific. Great tips as always. Thank you so much for this information. If you are a sufferer of allergies, you certainly will find that around the corner. You might want to look for these remedies. Well,